Good morning, everybody. I'll be presenting to you a disease known as schizophrenia. So, where it all started. Schizophrenia has been around for a very long time. However, the oldest records date back to Egypt in about the year 1550 BC. However, the first breakthrough with schizophrenia occurred in 1892 by a man named Dr. Emil Kraepelin. He initially named it dementia praecox. However, later that same year, labeled it schizophrenia. Here's a picture of Dr. Emil and some doctors of the time trying to pinpoint schizophrenia. So what is schizophrenia? Well, it's a very complex psychiatric disorder that affects how a person feels, thinks, and behaves. It's believed to be caused by a mixture of genetic, environmental, and cellular factors. The name schizophrenia comes from the Greek word schizo, meaning split, and phrenia, meaning mind, which is just fragmented thinking, which is a symptom of this disease. There are 5 main types of schizophrenia: paranoid, disorganized, catatonic, undifferentiated, and residual. However, more recently it has been referred to as the schizophrenic spectrum. So the symptoms of schizophrenia are categorized into 3 types: positive, negative, and cognitive. Positive symptoms are characterized by the development of behavior that isn't usually there. So this will include hallucinations and delusions. Negative, which is the loss of normal function. So this would be like blunted emotion and difficulty experiencing pleasure. And cognitive, which affects how a person thinks and thinks clearly. So this would be like deficits in attention, memory, and concentration. So some early signs of schizophrenia include withdrawal, signs of not doing well academically in school, trouble sleeping, irritation or depression, and lack of motivation. So anyone is susceptible to schizophrenia. However, males tend to be diagnosed earlier in their life, in their teens to early 20s, while females more later in life, in their early 20s to early 30s. You can see this in figure 4 of my board here, the relationship there. And schizophrenia affects about 1% of the population. To truly understand schizophrenia, however, we have to understand cell communication. There are 2 main types, the local and long-distance signaling. So local signaling is when signal molecules move through diffusion to the extracellular matrix to reach their neighboring receptors, while long distance is when a cell produces the signal molecule and sends it usually through the bloodstream to reach other parts of the body. And there are 3 stages in the cell communication, which is first reception, which is when a signal binds to a receptor, transduction, which is when the receptor gets activated by that binding, and then response, which is when something happens because of these first 2 steps. Here is a diagram of that happening. You see the signal molecule coming down, meaning the receptor, causing transduction, and then therefore a response. So what goes wrong with schizophrenia? So glutamate dysfunction is believed to be the main cause. Glutamate is a receptor, one of the main receptors of dopamine. So this is caused by hypofunction of the NMDA receptors, which disturbs normal cell signaling, and therefore leads to excessive glutamate release, causing acetotoxicity and dopamine dysregulation. This dopamine dysregulation is very important because it leads to hyperactive D2 receptors, which causes those positive symptoms that I was talking about earlier, and hypoactive D1 receptors, which leads to those negative symptoms and cognitive symptoms. Dopamine imbalance was ruled to be the main cause of schizophrenia because drugs that were used to block dopamine receptors were used, and they showed a decrease in schizophrenic symptoms. Here you can see a diagram of a person with and without schizophrenia. Here, these yellow dots represent glutamate, and there's way too much being produced, and this is causing a dysregulation between the D1 and D2 receptors, which leads to that dopamine imbalance, and therefore those symptoms that I was talking about. Schizophrenia mainly affects both the prefrontal cortex and temporal lobe parts of the brain. And also here, you can see the synaptic connections happening in the brain between someone with and without schizophrenia. This cellular dysfunction happening leads to a lack of regular cell function as compared to the healthy brain. And here, you can see an example of specifically the dopamine and just reactions taking place here is much more happening in a schizophrenic mind as compared to a healthy brain. So some genetic factors believed to be linked, and the cause of schizophrenia is a microdeletion found on chromosome 22. And you see in this yellow part, that is missing genetic material, which leads to the loss of a gene called COMT, which the loss of that gene directly relates to hyperactivity in the D2 and D1 receptors, which causes those symptoms that I was talking about earlier. This is only believed to be the cause for a small amount of schizophrenic cases. However, it is linked. And this is just a karyotype of a person with this mutation. So some environmental factors that are believed to be linked to schizophrenia are exposure to infections before birth, this could be if a mother has the flu or any kind of other virus like that. This can result in inflammatory response in the child and therefore lead to schizophrenic symptoms down the road. Severe stress during childhood, it tends to trigger those schizophrenic symptoms, as well as using cannabis, which a lot of people tend to use it to help dilute their symptoms. However, it only heightens them and causes more issues down the road. And also living in an urban area, you can imagine there's a lot more louder sounds and a lot more faster paced lifestyle, which leads to excess stress and therefore can lead to those schizophrenic symptoms. So schizophrenia is very difficult to diagnose. This is because it is a mental health disease, which means MRIs, CT scans, and blood tests will not pick up the signs of schizophrenia, which leads to a very lengthy diagnosing process, beginning with the physical exam, then testing and screening, and then finally a psychiatric evaluation. However, more recently, PET scans have shown to be more helpful in diagnosing due to the more advanced imaging of the brain, like you saw in that diagram earlier, and also here on figure 1. So there's no real true cure for schizophrenia. However, there are treatments. The first of which being antipsychotics, which are given to patients who show these acute schizophrenic episodes, and it is believed to block the dopamine receptors, which therefore reduces anxiety and aggression as well as other symptoms of schizophrenia. And however, for those larger symptoms such as hallucinations and delusions, you'll have to be on those drugs for a little bit longer. However, the downside is that if given for too long, this can lead to a side effect known as tardive dyskinesia, which is a condition that causes uncontrollable muscle movements primarily around the mouth. The second type of treatments are psychiatric treatments. So these will include therapies, first of which being cognitive behavioral therapy, which allows the patient to cope and learn to deal with their symptoms. Family therapy, which allows the family of a schizophrenic patient to understand the triggers and how to live with someone who has schizophrenia. And then art therapy, which provides a safe place for schizophrenic patients to express their emotions through nonverbal ways. It also gives them a sense of community. And here are just some examples of some art done in that therapy. Some awareness. July 25th is National Schizophrenia Awareness Day. The silver ribbon, and silver in general, is a symbol for schizophrenia, as you can see here on the board, as well as the iris flower, which is also there. And green also represents schizophrenia because it is used to represent mental health. You can also see it throughout the board. Some notable individuals with schizophrenia, first of which being Vincent van Gogh, Mary Todd Lincoln, who is Abraham Lincoln's wife, and Zelda Fitzgerald, who is F. Scott Fitzgerald's wife. So some closing remarks. What schizophrenia looks like down the road, if treated, the residual phase will usually be reached, which is when symptoms have decreased and the patient has learned to live with their symptoms. However, if not treated, the continued stress tends to enlarge the ventricles in both the prefrontal and temporal lobe areas, which can lead to a decrease in white matter by about 25%. New research has been conducted. A new drug that was actually approved in September of this year has been approved, and it's used to target the proteins in the brain, which indirectly reach dopamine instead of directly blocking those receptors, which has been shown to be about 30% more effective for decreasing those symptoms. However, the drug is still being tested to see what its long-term effects look like for the patient. Thank you so much for listening. These are my citations.